Welcome to another Counselor Soapbox video. Today's topic, steroids. When most people talk about steroids, the kind used for bodybuilding or to develop muscles, they're talking about anabolic steroids. All of these are scheduled on Schedule 3. That is, any physician can prescribe them, but they do require prescriptions. The results of taking steroids are not immediate. It has to be done slowly and over time. Users often do what is called stacking doses. They take one dose, but before it has left the body, they add another dose. Also, they may be doing multiple steroids at the same time, trying to get an increased effect. The anabolic steroids can cause euphoria and a feeling of increase in energy. Users become more and more competitive, and if they stop using steroids, most people become depressed. Anabolic steroids are synthetic drugs that are similar to the male sex hormone. Possession without a prescription has been illegal in the U.S. since 1990, and they are a Schedule 3 controlled substance. Generally, they're detectable in the urine from 4 to 14 days after last use, but more sensitive tests have resulted in some people testing positive as much as 13 months after their last use. There are some legitimate uses. For example, if an eye is scratched and the steroid drops are placed directly into the eye, it can prevent scarring. People with joint injuries may have an injection of the steroid directly into the joint, and it promotes healing. But there are also many not so legitimate uses for steroids. Testosterone and other drugs that act like testosterone are called anabolic steroids. The name comes from steroid chemical structure. Anabolic promotes muscle growth, and it does have legal medical uses. It is used illegally by both male and female athletes. Steroids come in both anabolic and catabolic. The steroids we're talking about as drugs of abuse are the anabolic. These should not be confused with the catabolic. Catabolic steroids break things down. These steroids are used for asthma, and they are not like anabolic steroids. Inhalers are catabolic steroids. Testosterone begins to develop while the male is still a fetus. Production increases dramatically during adolescence, and this is the way that males develop more muscle. And this increase in testosterone results in physical changes. One of these changes is an increased libido. This levels out and stays very constant after puberty. Steroids are widely used in athletics, but has been banned. Steroids' medical use is for slow, low doses. Abusers may use creams and try to reach a very high level. There are many efforts to beat testing since it's forbidden in athletic competition. Steroid abusers often take their steroids in higher doses or combinations of multiple drugs. Steroid deaths do not happen as a result of immediate use. They're the result of long-term problems to the body caused by steroid abuse. Steroids can cause serious heart damage, and death would be the result of that heart damage. Heart attacks and strokes are often found from using high doses for long periods of time. There are side effects of anabolic steroids, particularly when they're taken at high levels and for a long period of time. An increase in acne, balding, reduced sexual desire. In men, there can be atrophy of the testes, where they shrink up to be the size of walnuts or peas. Men sometimes grow breasts, and women can grow facial hair, go bald, the breasts shrink, and they develop menstrual irregularities. Women's voices get deeper. Basically, sex characteristics we would expect are reversed. There can also be an increase in cholesterol, an increased risk of heart disease, liver damage, which can lead to liver cancer. People doing steroids become irritable, aggressive, and may experience violent behavior. There's a phenomenon known as steroid rage, which is common with abusers, and some abusers develop psychotic reactions. From the user's perspective, some of the hazards of steroid use are in men, growing breasts, premature end to puberty, suppressed libido. It halts sperm production, though this is not a recommended birth control method, damage to the heart, liver disease, and cancer. Hazards for women include developing male characteristics, the deep voice, growing thick, coarse body hair, having male pattern baldness, and an enlarged clitoris. There are also psychological effects of steroid. Mild euphoria, a feeling of increased energy, but increased aggressiveness, irritability, and sometimes violent behavior. People doing steroids may experience mood swing and psychotic reactions. Users have higher than expected rates of death from violent causes, probably because of their irritability and getting into frequent confrontations. And there can be specific withdrawal symptoms, one of which is the irritability, but it is also a drug which produces significant dependence. Some other possible side effects of steroids include episodes of roid rage, which bring people into conflict with others and with law enforcement, manic episodes, stopping resulting in depression. During that, there would be little euphoria, and people who abuse steroids do develop tolerance, do experience withdrawal effects, and frequently experience craving. Steroids are an addicting, dangerous drug. Thanks for watching another Counselor Soapbox video. What's ahead? More drug education videos, many about specific drugs. Also, some mental health and wellness videos. If you've enjoyed this video, please click the like button, which is directly below this. Comments are always appreciated. And to receive new videos in this series, please subscribe to the Counselor Soapbox video channel. Thanks for watching the Counselor Soapbox video channel. For more information on this and related issues, please visit the Counselorssoapbox.com blog, where you'll find over 1,500 texts, articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are now available on a wide variety of ebook sellers platforms. The photos here are all courtesy of Pixabay and Wikimedia and are licensed under the CC0 Creative Commons free for commercial use, no attribution required license. Thanks again for watching.